Okay, we'll go ahead and get started. We've got a couple of other people due to log in, and we'll just have them join the conversation as we go. So it's I would like to welcome everyone to the 13th episode of GFBF Talks. Wow, I can't believe it's been 13 episodes. I actually thought it was 14, but Vanessa corrected me. The 13th episode. And on behalf of the Georgia Firefighters Burn Foundation, Board of Directors and staff, we would like to say welcome to GFBF Talks, something that we've been doing to kind of maintain connection in the community during this pandemic, where we can still come together and still kind of avoid or step around the pandemic. And the Georgia Firefighters Burn Foundation is a 501c3 nonprofit organization, and our mission is to partner with the fire service and burn care community to provide fire safety and prevention education, support medical facilities, and assist burn survivors in their recovery. And the end of that mission statement, assist burn survivors in their recovery, really is the gist of what we do, which really is what created, was the thought behind creating these GFBF talks. Since we can't come together physically right now, we can connect in the internet world. And it's been pretty cool. It has its pros and cons, but it does allow us to stay connected. And it's just our privilege tonight, as the invitation states, that the title is Burn Care Nursing, Much More Than Just Medical Treatment. And we think that title kind of says it all, because nurses are not often looked at as people. And we say burn care nursing, but really we're talking about nursing. But when you drill down even more than that, we're talking about people who are helping professionals. And that's really what we want to drive the conversation tonight, to just talk about being a nurse, being a helping professional, and how do you balance that with being a person? Because you do have other stuff going on. And I'd like to have you guys do some self-introductions as we get started. And again, we've got some other folks logging on, and as they log on, we'll just pull them into the conversation and do some intros with them as well. And we can start with you, Mark, whatever you like to, however you like to introduce yourself.
Oh boy, thanks, Dennis. Thanks for having me, by the way. I appreciate the opportunity to be on with you. My name is Mark Hodges. I've been in healthcare for 25 years now. We won't say the first word there. It's a lot.
Since you were 5 years old, right?
Foundation for about 22 years now, which has been a good run. I've really enjoyed my time and the opportunities that the foundation's offered me. So thanks for letting me be here.
Great. Well, we're glad to have you. And Miss Anita.
Can you hear me?
There you go. Yes.
Okay, I apologize. I'm Anita Fields, and I work in the North Carolina J.C. Burn Center in Chapel Hill, North Carolina. In fact, this summer I just celebrated my 35th year as a nurse and in that burn center. So I've had a variety of jobs during that time, from bedside nursing to management to care coordination, and now I direct all of our aftercare programming. And I can honestly say that for me, working in the burn center was not just a job as a nurse, but it has been my calling more than a career. I'll say that.
And when you say it's a calling more than a career, what do you mean when you say that?
Can't hear you.
You cannot hear me?
Can you repeat it? I apologize. I am in the mountains and the sound just goes and comes. So could you repeat that, please?
Yes. The question was, when you say it's been a calling more than a profession or more than a job? What do you mean by it's been a calling for you?
So for me, going to work in the burn center every day was more than just getting up and going to a job. So I've had jobs and I would go in and I would do those jobs. But for me, working in the burn center has been something that fed me as much as I gave to it, if that makes sense. Through my work, I have learned a great deal about myself, and through my survivors, I have also learned how to recognize some of my own personal struggles. And through that, I feel like it's just been something. I'm a person of faith, so I apologize if this offends anybody, but for me personally, I feel like it was something that God intended me to do. When I was first getting out of high school and going to college, my grandmother kept telling me I should be a nurse, and I kept thinking there was something more glamorous that made more money than being a nurse, and I tried real hard not to be one. And through a lot of peaks and valleys, after unsuccessfully finding my way, 6 years after graduating from high school, I found myself thinking, well, maybe my grandmother was right. And so I went back to pursue my degree in nursing and ended up as a new graduate nurse in the burn center and have been there ever since.
Wow. Wow. And I'm going to bounce this over to you, Mark. Do you feel that nursing or a helping profession has been a calling for you or taps into your purpose or your passion?
Very much so. I mean, it becomes who you are and how you're identified and how you identify yourself to others. You know, if it wasn't for my background in pre-hospital care and helping professions, I don't know who I would be.
Because I think, as I said earlier, I think as helping professionals or as nurses, you're not always looked at as people. You know, you're the person that comes in and you take care of me. And a large percentage of our audience, the people who view these GFBF talks, have been in that hospital bed. So this connects to that population in a little bit different way. And speaking for myself, I had a real love-hate relationship with my nurses, you know, when I was burned, injured, and in the hospital, because there were things nurses had to do for me for my own good that I didn't appreciate, didn't understand. And it hurt, to be honest with you. You know, you guys hurt me and I didn't like you. I don't use the term hate at all now, but back then I hated you guys, but I also loved you as well. I hated you because you caused me pain, and to tell me that it was for my own good didn't resonate with me. All I knew, it hurt. And you were the people causing the hurt. And I hated nurses. I did. But I also loved nurses too, because you also brought that medication in there that made me feel better. Unlike the doctors came in and, you know, looked and poked and prodded and those kind of things. And then they were on their way. You know, doctor never came in with pills for me to take or a shot. You know, he gave orders for it. So the doctor would come in and do what he did, but the nurses were the ones. And I can honestly say that over an 8-month hospital stay, you guys as nurses became my family more than my actual family. And I say that because you were the guys who were physically touching me. You know, my family would come and visit, but they didn't bring me medication. You know, they didn't touch me because, you know, a burn center is a very sterile place. And we're not going to get into burn treatment and those kind of things. We really want to get into the relationship of a nurse and patient, or a nurse and a doctor, or a nurse in the hospital, or a nurse in your outside life. And for a while, I didn't know nurses even had an outside life. And I'm really curious, how do you not take it personal when you're a nurse and you're doing things to help me and I don't like you? I don't understand what you're doing. You know, I challenge you. How do you not take it personal? And then before you answer that question, I want to acknowledge someone who just got on. Carlanda?
Yeah. Hi.
Yes. Hello. Are we going to see you or are we just going to do your photo? It's fine either way.
That picture.
Okay. Well, I'd like to do just a real quick introduction. You missed the intros. Do a self-introduction of who you are and what you'd like to share real briefly.
I'm Carlonda, his niece. I'm a new LPN graduate. I just graduated in May, and I work in home health care. That's it.
And I have to kind of brag on her. That is my niece, and she just had her pinning ceremony last month, and she worked really, really hard to get
Thank
that
you.
on her lapel, and I'm just so stinking proud of her. And I thought it would be kind of cool to get her on a panel with some quite seasoned nurses, 25 and 35 years. Wow, and 1 month. So this is a pretty cool diverse group we have here. But going back to the question, how do you not take it personal? How do you not get discouraged with the person you're trying to help doesn't appreciate you, doesn't understand you, and can be not nice to you? And that's a question for all of you guys. I'd like you to respond to that.
You grow some really thick skin, Dennis. You have to. And you're doing the right for the patient and or the person. What's going to come around for the survivor is going to be beneficial for them. But it's thick skin and knowing in the end it's going to be okay.
Mm-hmm.
Dennis, I do have to say how I dealt with it as a newer nurse is very different than how I deal with that now. When I was a new nurse, my thought processes were very clinical in that if you don't do A, then B will happen. And we're just doing this for your own good and all of this kind of thing. But what I have learned through the years, and I actually try to help newer nurses understand this, is that it's really important for us to put ourselves in that bed like our patients. So I have had a number of patients over the years who were very angry. They had every right to be angry. They were had lost all hope. They just wanted to be left alone. And getting well, as you know, from a burn injury is hard work. It is really hard work. And we as healthcare professionals don't stop to think sometimes how much energy it takes for a burn patient from the time they wake up in the morning until they finish their day in the evening. And their schedule is very rigid. You have to have breakfast at this time. You have to have OT at this time. You have to have PT at this time. To have to get your dressing changed at this time. You have to get PT again at this time. You might get to go to rec therapy at this time. Then you have to have meals and you might get 1 hour in there to rest. Mm-hmm. The thing about it is that you're so exhausted, it's hard to rest. So I think when I was earlier in my profession, I saw patients more as their disease process. They'd been burned. It was my job to take care of their burns. And I did try still to do it the best that I could, to be the most gentle. But I think some of the things that you're describing in your experience was the things that were so big for you, and you were an adolescent at the time, which makes it even more difficult. You didn't have that much control as an adolescent, but what little control you had totally been taken away from you. And so these people came in and forced things upon you every day, and didn't stop to think about giving you a choice in something. Now, as a nurse during that time, I remember just as vividly today the first patient I took care of, that I went home in the morning, I worked a night shift, and when I came home, that patient had died during the day. And I felt like I had missed something, that I had let my patient down, because for whatever happened, I had done my best to take care of that patient, but he still died while I was home sleeping. And that really affected me. So anyway, I feel like I'm rambling now, but I hope that made sense. That as a new nurse, I was very focused on the things I did to the patient, and I would do them with kindness, and I would do my best to help them understand why we were doing those things, and to make sure they were comfortable, and to treat them with respect. But as a more mature, experienced nurse, I took more effort in trying to understand what it was like for them than just going in and doing something to them.
Mm-hmm. Mm-hmm. And you know, it's not always understanding, because I didn't give a damn. You know, I didn't care about this is going to help me in the future. I didn't.
That's
care
right.
about it. And I guess coming out as an early nurse, you're going to change the world, you know. And
Right.
Carlonda, for you coming out and not having near the experiences that these geezer nurses have had.
You're so complimentary.
Yes. What is the thing? What is the thing for you? There had to be a reason you chose to be a helping professional. What is that?
It's rewarding to me, helping people get better. And like to piggyback on what y'all was saying about like not taking it personal, I've been a caregiver like forever, since high school. I just feel like it's what I'm supposed to be doing. I put myself in their shoes. Like, it is frustrating, and it seems like it's gonna take forever to get better. It's like if you gotta go to the bathroom and you driving and you know it's gonna take you like 10 minutes, and it's like really, really frustrating, and you just like want to smack somebody. Like, I understand. So you can't take nothing personal. I don't know about having tough skin, because it's like, me personally, I don't really need it, because I don't take it personal, because I get it. Like, I understand. And I just, like, I don't know. I just feel like that's what I'm supposed to be doing, helping somebody get better. Like, if they could do it themselves, they would. Somebody got to do it. Somebody got to help them.
Mm-hmm.
And
Mm-hmm.
I choose to.
Mm-hmm.
Like, whether in all the strict schedule burn victims have, burn patients, like, it's frustrating. Like, I get it. You got to, like she said, eat this certain time, do this a certain time, do that. And it's like, the next person come in here, like, I'm not gonna like them, and you just know that already.
Mm-hmm. Mm-hmm.
So I mean, like, I understand.
Yeah,
and you gotta have like a certain connection with them so they know you understand. It's like simple stuff. Like, if it was the hands and they can't pick up a cup, like, that is frustrating. Like, if I could pick it up, I will do it myself. So can you just please give it to me? And I gotta have somebody give it to me or tell me when I can drink this, and it's all up to you. Like, yeah, I don't like that.
Mm-hmm. Mm-hmm. It's sort of a loss of independence. And having said that, I want to toss this over to you, Mark, because you've been the burn nurse, our medical go-to guy at burn camp forever. And I recall coming into the medical cabin one evening, and you were sitting in the area, the front area, and there was this wee small voice off in the distance singing. And it was one of the kids that was taking a shower, and I don't remember his name, and I don't even want to mention his name, but if you could kind of share that story, because it was just one of the highlights for me of all the years of camps I've been doing, and just that thing right there, allowing him to do what he could.
Yeah, that was our first winter camp, when we had that little cutie patootie with us. What was your question?
How you got to the place of allowing him to do something or attempt something that he hadn't had the opportunity to do at home. And it was just a simple thing of taking a shower.
I honestly can't answer that, Dennis. You let them take the leaps that they need to take in order to get where they want to go. I mean, he was rip roaring ready to go. You asked him what he wanted to do. I want to do this. Do you need help? No, sir. And to do it on their own. It's amazing what some of our young kids can accomplish. I think, me personally, dealing with younger burn survivor population versus the older burn survivor population, I think kids, especially young ones, have an easier time of it because they're so moldable still in plastic that you're able to teach them better. They don't have bad habits to lose, so to speak. I'm sure Anita can confirm that with me. But you just give them as much leash as they want and let them fly loose.
Yeah, and that was always that's been a highlight for me because the kid had lost all of his fingers on both hands in the fire, and he had never given himself a shower because his parents always took care of it. And I remember coming in there, and you were just sitting there drinking a coffee, and you were just hanging out, and he was way in the back in the shower, and you could hear his voice. And he was singing, and I remember, I think you got him a soap on a rope, didn't you, and tied it to his wrist or something so he wouldn't keep dropping it. And he was just...
Yeah, what we did with the soap. Kenzie actually came up with that plan. But yeah, it was a group effort, that one.
Yeah, and it was just so cool. And said, no, he'll be back there as long as he needs to. However long it takes him to take his shower, we're going to give him that time. And I remember how surprised his mother was when she came to pick him up, that she could not believe in her wildest imagination that he was giving himself a shower, but she didn't know. You know, she just didn't know. And having said that, how difficult is it to recognize the patient is not just the person in the bed? That, you know, it impacts the visitors, impacts the family who are dealing with this as well. And how do you guys handle that? And how do you even recognize it?
No, it's one of the things that I teach when I do burn education classes, that the burn survivor is more than just the patient. The burn survivor is the whole entire family, because it's going to affect the whole entire family. Grandparents, parents, siblings, it doesn't matter. And that's one of the reasons we started doing the sibling camp, because it impacts the others so much. It's more than just the patient in the bed.
Mm-hmm. Mm-hmm.
We did that too. And I will tell you, listening to you talk about that story, what I have found is that education for the family to understand that their feelings of guilt are very real. Even if the parents had nothing to do with their child getting burned, they still have this guilt. We feel like our job as parents is to protect our children. And when they get hurt, then we go into overdrive trying to compensate for that. And sometimes I think that piece of the parents not knowing is that they feel like they're doing everything they can to make up for the fact that their child was injured or whatever. So it's not out of maliciousness. So I agree with Mark. Education has been so important. And actually, one of the things I enjoy and get a lot of gratitude from is talking with families, particularly parents of children who are younger, and telling them, you know, the guilt is real. It's a normal emotion. You go on with that. But that you have, part of our goal is to get kids back as close to their normal selves like they were before they got burned as possible. And in order to do that, we need to give the freedom to do the things that they were doing before. Now, yes, there are a lot of kids who may not be able to do the same things the same way they did them, but we certainly have learned a lot through Paralympics and other things that we see in the country with kids who have lost limbs or that kind of thing, that kids are incredibly resilient, and they teach us a lot. I mean, they'll try things before adults will, I find, a lot of times. So I think a similar story. I had a young kid who had just graduated from high school, and he had not graduated from high school. It was prom weekend, and they were on a lake and a boat exploded, and he was burned, and he played basketball, and his dad just kept just saying, well, his basketball career was over and all of this kind of stuff. And I had to take him to the side and say, okay, I understand as a parent why you think that, but let me just tell you, that is not what we are teaching your son. And you have to be on our team, because if he wants to play basketball again, he will play basketball again. He can do anything he sets his mind to do. And about 6 or 8 months later, this same father, who happened to be a superintendent of schools in their county, came and brought me a video of this kid who went out on the basketball floor in high school, and he still had to wear garments on his legs. So in order for him not to feel, like odd or whatever, his entire team wore black garments on there as part of their uniform, so everybody on the team would look like this kid. And he was like the star of the basketball team. But it took educating the parent about what he needed to let him try to do. But it is hard for some parents, I think, and guilt sometimes is a barrier to that. Mm-hmm. But it just makes education more important and more gratifying when you see the light go on for a parent. And it's almost like giving them permission to let their kids struggle to try, even walking again or, different things.
Mm-hmm.
We as parents have a hard time seeing our kids struggle, even
exactly.
though it's the best thing for them.
Mm-hmm. But looking at it from the flip side, and I want to pitch this one over to Carlonda, because we're talking about, as a nurse taking care of kids, but because I think I knew Carlonda was going to be a nurse long before she made that leap to go to school. And from a child's perspective, because I know what you experienced taking care of your family members, your grandma, your great grandma, and mm-hmm. your grandfather, and all of those things. How is what Mark and Anita saying, how does that resonate with you? What's the similarities or differences between not taking care of a child, but a child taking care of a parent?
Wait, what?
I'm so glad he confuses somebody else besides me.
Like, what am I answering?
So much better.
They talked about taking care of children and educating children, but looking at it from a different perspective, where you were a child taking care of your grandma, your great grandma, being a part of that. What were the challenges or rewards with that? Or is it very similar to taking care of a child, what they were saying?
It's similar. I felt like I was obligated, like I was supposed to. And like for listening to them, like, I don't think it would be, I guess for some people guilt, but like others, it's just like, you have to, like, it's your baby. You got to do it. Like tying their shoes when they 3, like my grandma, like doing stuff for her. My mom then would more than I would, but I don't take anybody's independence away. If they can do it and they have confidence to, then let them. Like if I knew she could do something, I was not doing it for her. She would get mad at me, but I'm like, I really don't care, because I know you can do it. Like, I'm not helping you put your shirt on because I know you can do it. And she would do it. And I'm like, see? And then we would both be happy at the end. Like, I've had patients the same way. And it's like rewarding seeing them like, see, I said you can do it. So like that soap thing, that's something I would have did. I probably would have put it in a sock and put the sock on his arm. So he did it that way. They're like, yeah, you can do it. Don't take it away. Like if the parents see, or children see parents and it's like, oh, well, you can't use your fingers, so you can't do that. Don't tell them that. Like, don't say that. Let them try. Mm-hmm. If they fail, then you talk to them like, okay, just try again. Like, don't do that. Don't put yourself down. Like, you can do it. Just try to. Then if you see you can't yourself, then we'll talk about it and a different way to figure out how to do it. But it's just like the independence is a real, real big thing, and confidence. Like they got to be confident or they're not going to be independent.
Mm-hmm.
I mean, it's like, it's like the same. Like, I know it's seniors and babies, like you don't call seniors babies, but it's like kind of the same.
Yeah,
You
they're
gotta
babies
take care of
again.
them like you take care of a baby. You got to take care of a senior like you do, like a baby. So it's like the same, but if they can do it, let them do it. And don't like, no, don't do that. We're going to try this later. If it take an hour, I just had a patient. She was a senior and she was getting over like heart surgery, but she was like, oh, I know it's taking me a long time. I'm like, it's fine. Sit there, cross my legs, like, put your shoes on. If it takes 15 minutes, we going to sit here. You can do it.
Mm-hmm. But doesn't healthcare now, it's become such a business. It doesn't really allow for bedside manner anymore, does it? Not the
No,
way
and I don't
not the
like
way
that.
it used
It
to.
doesn't. But I don't listen to it, and that's probably how I get in trouble. But yeah, it's more of a business, and I think that's disrespectful.
And how do you balance that as a nurse that's answering your call or living your purpose, or your job is your passion? How do you balance that working in a profession that's really a business now? I mean, it really is a business.
I don't
How
know. And
how
I'm
do you balance that?
coming from all of y'all, and y'all been in the field like a nurse longer than me. I've been a caregiver, and I'm kind of hard-headed, so I really don't listen to stuff like that. And people don't like it, but I don't know. I don't really follow it like that.
And I agree with Carolina. I don't follow. I mean, you have to do what the hospital expects you to do. So, and the big thing in the business model is you do more with less. But at the end of the day, my relationship with my patient is the most important thing.
Yep.
And years from now, they're not going to remember. Now, some of our patients do remember which room they're in. And, you know, a lot of them don't remember every single hurtful thing that was done to them, but they remember the individual nurses who made them feel good.
Mm-hmm.
They remember those nurses who gave them hope, who spent extra time with them to make sure they, you know, take the extra 5 minutes to listen to them, or to make, it's really all about how you make your patients feel. And no business model can take that away if you really are a nurse who's gone into the profession to help people and care about your patients. I really believe that.
Mm-hmm.
Now, you may not have as much time to do the touchy-feely things, and that is one of the most frustrating things for me, but you still can make your patient feel good.
Mm-hmm. Mm-hmm. And to help people, we all like to feel appreciated. And you like to hear thank you. You know, you like to hear, we all like to hear that you made a difference, and thank you. But when you're not getting that, and I know you say thick skin or you don't care and those kind of things, but you're human. And despite being a nurse, you have needs as well, you know, and we talk about compassion fatigue, and we all know usually the people who are most willing to help others are the ones who struggle the most receiving help or accepting help. And I'd like to talk about that a little bit. What do you do for self-care, and why is it important?
You can't help nobody if you don't help yourself. Like,
you gotta put number one as exercise, having a good cry on the way home from work, traveling, spending time with your family. To me, one of the big things that helped me deal with everything that I encountered in the burn community was the burn camp. That was actually a very cathartic, healing. Hey, I remember this kid. I transported this kid yada yada years ago, and here they are. Wow.
Mm-hmm. And we
I agree with Mark.
Well, we may have people that are tuned in that don't really know what burn camp is, and when you say it's cathartic for you and it benefits you, could you guys elaborate on that a little bit more for those who may not understand what a burn camp is?
Well, you can explain what a burn camp is. That's your niche.
Okay. Okay, it's a residential or day camping program for children to come and have camp activities to kind of normalize the camp experience for children and their siblings. But what we call it is fun with a purpose. You know, the canoe trips, the bike riding, everything is geared towards self-esteem and conflict resolution, effective communication, and just encouraging the kids, giving them an outlet to stretch themselves beyond what they thought maybe was possible. That's what the camp structure is like in just a broad brushstroke. But how is it cathartic for you?
I think it's seeing all what we've done come to fruition, all the hard work that we put into the survivor, their work in the hospital, the work with PTOT, knowing that they have come out of a very, so to speak, dark place, dark time, hard time in their lives, and are doing so much better now, and are, for me, being a kid and doing all the things that a kid loves to do and can let their hair down and just go hog wild.
Mm-hmm. Mm-hmm.
Yeah, I would also add that, you know, we do at our burn center, we do more than just camps, which I know you also do, Dennis, and a lot of burn centers in the country. So it's even more than the structure and that kind of thing. It's just an opportunity to come together with other people who are like you.
Yeah.
That to me is the most powerful part of burn camp. I'll also tell you, I've learned how to be a better burn nurse by being involved in all those activities, because when, you know, years later, so like even you, now you still teach me about things I can do to help a patient better by sharing your experiences that you had when you were a burn patient in the hospital. So when I'm involved with these individuals in a fun environment, oftentimes they're more willing to talk about something, you know, just freely talk about something versus, you know, me even asking them or whatever. But I agree with Mark that for me personally, if I had not gotten involved in Camp Celebrate early in my nursing career, and from that helped expand aftercare to include many different opportunities for patients to get together, I think I really would have burned out sooner. But being able to go and see that patient that I worked with so hard, you know, come back and have just such a fun life and see them, you know, a lot of our kids come to burn camp, and unless you knew what was under their clothes, you wouldn't really know that they were burned. I mean, a lot of our volunteers come and say, you know, if I didn't know this was a burn camp, I wouldn't, you know, unless you saw certain kids, they wouldn't know that's what it was. It was just a lot of kids having a good time. And so wasn't that our goal when we were at the bedside, helping those kids getting back to having a good time, or those adults coming back? To me, that has been the biggest gratification for me. And I even, when new nurses come on, I tell them, if they want to be a better nurse, get involved in aftercare, go to the World Burn Congress, go where you are with burn survivors who have been survivors over a period of time, because they will teach you how to be a better person, and they will make you feel more gratification and pride over the work that you do. It just makes you want to be a better burn nurse.
Mm-hmm.
So that is why I'm still where I am 35 years later.
It's interesting you use the term, if it hadn't been for burn aftercare programs that you've been involved with, you would have burned out maybe a long time ago. And we're talking about.
That's right. Yeah, I didn't mean that on purpose, but anyway, it came out that way.
But there is power in community. And when COVID shut everything down, it really became obvious about the power of community and how important that is, which was really the motivations for starting up these GFBF talks. How can we stay connected? How can we keep the community connected while we get through this pandemic? And I hear you when you guys say, you know, it feels real good to see all the work that went into this person, and you can see it on the other side where your efforts weren't in vain. But let's talk about the other side. You know, what the patient died. You did everything you could, and the patient died. You know, what's the, where do you get the gas from to motor through that, if you will? Okay, I feel good because, man, little Johnny, he was just, oh, he was terrible when he came into the hospital, but now look at him, he's running, he's riding a bike. Okay, what happens if little Johnny dies? What happens if someone's grandfather passes away? And like you said it earlier, Anita, a patient made their transition while you were at home, while you were off shift, and you begin to question, what didn't you do? You know, what did you miss? You know, because yeah, we like to celebrate the successes, but what about the other side? And it's very real. It's part of the occupation. How do you manage death? And I'm not sure.
You know, I will.
Go ahead.
I'm sorry. I will say, I think this is, over my 35 years, this is a constant conversation that nurses have, because for them, oftentimes it's even an ethical issue of, are we really doing the right thing by, you know, going all out and providing this very expensive care for somebody who in all likelihood will not survive.
Mm-hmm.
Then there are those people that you work so hard and they've done so well, and then for whatever reason, they don't make it.
Mm-hmm.
Different people, I think, cope with that in a different way. For me personally, because of my faith, I truly believe that I am only as good as God lets me be. And not every person who is who's burned or sick or whatever is meant to survive. And sometimes that plan is better for the person. Now, not necessarily better for the family or the people who love them, but for that person, it is oftentimes a blessing. It doesn't mean that it is easy for the staff, because when you invest so much of yourself in something and then the patient dies, I won't lie, it's difficult. It is really difficult. And that's when self-care becomes even more important. We're fortunate at our hospital in that we have a very active pastoral care department who comes and provides support to our staff as much as our patients and our families. And it's actually a hospital policy that for every death in our unit, that person comes, and they're not coming to pray. They're coming to support the staff. They're coming to support the family of the patient who died. They're an extra pair of hands if we need to help the families out of the hospital or whatever. But we really do recognize that, you know, a lot of work goes into our patients. And when it doesn't always end with a happy ending with the patient leaving the hospital, it's really difficult. You know, some days it just really sucks, and there's no other way to put that.
Mm-hmm.
So you have to really work toward your own self-care and how you cope with that.
Mm-hmm. And when you experience that, is crying in the drive home enough, Mark? Is that enough? You shed a tear in the car?
No, because it stays with you for a long time. You know, shedding a lot of tears in the car on the way home, hugging your kids even tighter, your family even tighter when you get home. Um, Other outlets, hopefully they're healthy outlets. You're staying away from the drugs and the alcohol. We know that runs rampant in our field, unfortunately, when dealing with issues. But hopefully you have healthy outlets to do it. And coming back again the next day to realize that there's going to be somebody else that you need to take care of, someone else that you need to help, and give it your all. And you do it with that person that passed away on your mind still, to make you a better provider, make you a better person, and better at what you're doing.
Mm. And then the guilt.
Dennis, I will tell you, I'll openly admit I don't wait until I go home to cry, and I have many times openly cried with families at the bedside, and I just.
But that's
I think
that's not professional, though, is it? That's not professional.
Oh, I think it is.
Professional?
Is it?
I think in the old school, I'll give Florence Nightingale all her credit, but things have evolved a lot since then, and I think in being a family member myself of someone, my mother passed away in a hospital, and she wasn't even in the ICU for that long, but just the story of it, and we just had this bond with this nurse. It humanizes nurses so that the families know that you just weren't coming in taking care of a diagnosis in the bed, that you really cared about my family member. And that's worth all, and I've been on both sides of that.
Mm-hmm. Mm-hmm.
As a caregiver and a family member.
And God, just have to take a deep breath and like you say, Mark, go back the next day. Just take a deep breath and stay at it. And when do you know? And this may not be a fair question to Carlonda because she's a baby nurse right now. But when do you know you need help? When do you know? And I know you say healthy self-care and do things. Okay, those are nice flowery words to say, but when do you know? When do you know you need help? Because you're the helper, so you don't ever really need help, or is it harder to see it?
I think it's harder to see it when you need help. And, I've had my family members call me out on it and say, you need to go talk to somebody, you need to do something because this is really eating you up and not in a healthy way.
Mm-hmm. Mm-hmm.
I will readily say that I did not always do a good job of balancing my work life and my family life. And I'm not very proud of the fact that my family came up on the short end of the stick more times than not. In my nursing career, that'll be my biggest regret, was that I didn't do a better job of balancing things. Early in my career, even before I started into nursing, I knew that I suffered from depression, and I had become a nurse at the bedside. That was fine. But when I became a manager and took on a bigger responsibility, and then, everybody blames the manager for everything, whether that's true or not, you just get blamed for that. And I'm a person who likes people to like me. I just, I'm that kind of person. And I realized that I was having panic attacks at work. And so I sought help for, like Mark said, my family also, called me out and said, you've got to do something. You've either got to quit working in the burn center or you've got to get help, because this is not gonna fly. And so I did, and that was, probably 30 years ago. And my psychiatrist has even some days wanted to say, that I was doing really well and she didn't think that I needed her anymore. And I said, now that is not going to happen. We are going to continue to touch base because, it's such a fluid thing, right. Depression. And, I know I have learned my body over the years to know when I'm not doing so well and when I'm doing okay. And so when I'm not doing so well, I call her and we talk more frequently. When I am doing okay, I might not talk to her as much, but we always touch in every couple months. So I will also say, if the pandemic forced a lot of things to happen, and one of those was for healthcare organizations to focus more on their employees and not only talking about self-care, but making ways possible for them to get self-care. I would do some of these things, mindfulness things, or, just taking a staff meeting and play games, or just something to take the seriousness away. But I do think that there is a lot more focus on people now and taking care of themselves than there was before the pandemic.
Mm-hmm. Mm-hmm. And Carlonda, as a new nurse, I'm not even gonna say new nurse. You're a nurse. As a nurse, what are some of the challenges that you're having now as you navigate this, if any? You may not be having any.
Navigate what, like the pandemic, or
no self-care, or balancing it, because being a nurse in your profession and also going home to a house full of kids, you're never off. The switch is always turned on. And what do you do, or what are you challenged with your self-care?
Now I'm better with it. I'm better with it because I just had to learn I gotta say no. Like, you gotta be selfish with yourself, if that makes sense. And don't feel guilty for saying no or for not doing something for somebody. Even my kids, because like I said, if I'm not okay, I can't help them.
Mm-hmm.
Like, if I'm stressed and my head is not right, then I can't have any answers for them. Then there'll be answers, but they won't be the right ones.
Mm-hmm. Mm-hmm.
So I just have to just ignore it. And I recently got better with that, like literally just ignoring everything.
Mm-hmm. And with
myself.
And with these GFBF talks, we're very intentional about not providing a whole lot of advice and telling people what they should and shouldn't do. But I'm going to take some liberties here because I love my niece and I'm so proud of her. And we have these.
I'm proud of her too.
I am, but to have this opportunity to have these two seasoned nurses, what would be a bit of advice you would give her as she's starting out in her career? Knowing now what you didn't know then, what would you tell her that you could tell you wished you had known 35, 25 years ago?
Listen.
I think some of the things that I just talked about, for me, looking at ways to, for me, it was finding a place to work with a population that I adore. Not everybody finds that right away. I was very fortunate in doing that, but I think that was big for me. The other piece, and something I do tell a lot of nurses, is that, especially in burn nursing, we do have this opportunity to be involved with patients after they're out of the hospital and, that kind of thing, and learning from your patients. That is the best education I ever received. So for burn nurses, I encourage all new nurses to go to the World Burn and to learn things outside of just coming to work and doing a job every day. Go and find ways that you can learn how to do what you do better.
Okay. What do you got for them, Mark? You're muted. You're muted.
Technology is not my forte still, but I agree with it. Listening to your patients, listening to your families, or the families, you take so much from that. Going to World Burn, it opens your eyes as to it's a whole huge world. out there, and hearing the stories from other providers, learning how other providers cope with their issues, with their grief, with their stress, with their joys. Being part of the community.
Mhm. Mhm.
I will say too, in line with that, taking it even further, is expand your professional village. It's not just all about the place where you work. So probably one of my greatest blessings in the world has been the work that I have done with burn survivors outside of our burn center and our hospital, being involved with the Phoenix Society. And I mean, it's how I came to be so close with my brother from another mother, Dennis, and, so many other burn survivors and burn professionals that I consider my extended family across the country. That is, it is worth its weight in gold. And it has really kept me so invigorated in my profession. That I just, every time I'm with one of you guys, I just get, really excited about the work we're doing and the things that we can do together, the things we've already done, and, doing these kinds of things. I mean, here I am on vacation, but it was important enough to me because I'm getting something out of this, but also it's because my good friend Dennis asked me to do this. And that is just, I've just made more friends. So make a lot of friends who are in your profession because you support one another.
Great. Because we've got a couple of minutes left. And do you have anything you guys would like to share as parting words of wisdom? And we're going to start with my niece here, Carlonda. You have any parting words of wisdom you like to share with the internet world out there as a helping professional?
Not really. I don't. Not really.
Okay. She's so stinking sweet. I mean, I just love her to death.
I want to talk to her again in 10 years.
Yeah. All right. Mark, parting words of wisdom.
Just remember that your nurses are human too. We make mistakes, we bleed, we cry. We have emotions, and we'll probably end up sharing them with you eventually before it's all over, but we're human as well.
Nita?
I think just to go even further with what Mark said, is not to be afraid to be human, and to share your experiences with other people, because I think you're not the only one feeling the way that you feel. Sometimes it is very difficult, and that's how, that's how we can practice what we preach in bringing burn survivors together to get support. I think we get support from one another in our profession. And you have to be willing to, admit your weaknesses or, your humanness.
Well, I really want to thank you guys for being on, and not just being on, but for being present in the moment. And it's extra special for me because my existence has everything to do with nurses taking care of me. And I'd like to share the thing that I remember about the care I received from nurses. It wasn't the bandage changes and the medication and those things. It's being in the hospital for 8 months. My mother came every day, and I saw the exhaustion on her face. But my mother wouldn't leave. I mean, she came every day for 8 months, but she wouldn't leave unless I was asleep. She wouldn't leave unless I was asleep. And I would look at her sometimes, and she would look so exhausted that I would pretend to be asleep. And I would pretend to be asleep, and I'd listen to her, get her things together, and tip out of the room. And the elevator was right by the nursing desk, which my room was right by the nursing station. And I would hear her talking to the nurses waiting on the elevator, because going every day, you become friends and family. And I would hear that elevator ding, and she'd get on the elevator and say, okay, guys, I'll see you guys tomorrow. And when I would hear that elevator door close, man, I would just bawl my eyes out, because I knew she needed to be home because she was tired, but I wanted my mama to be there with me, and I would just bawl my eyes out. And what I do remember is the nurses that would come and hold my hand while I cried. It had nothing to do with medication or treatment. They would hold my hand while I cried. And they kept that secret. They didn't let my mother know that I was doing that, because I told them why I was doing it. They understood it. And that's the thing that resonates with me all these 150 years later. That little thing, just holding my hand and allowing me to keep that secret, because my mother knew I was doing that, then she'd never leave. And they kept that secret with me, shared that secret with me, and held my hand while I was bawling, because I was a kid and I was afraid and I was scared and I was lonely and wanted my mama there, and they filled the gap for me. And that's the thing that I remember. But when I was discharged after 8 months, I said those nurses were my family, but I never had the courage to go back to that burn center after I was discharged. And I felt guilty, because I said, man, you guys did so much to me. How dare I not go back and visit? But I could not separate the love I had for nurses. I couldn't separate it from all the trauma that was in that place. So I never got a chance to truly tell them thank you, but you guys have afforded me an opportunity time and time again, and tonight, to say thank you to you for what you do. And vicariously, I'm thanking them all those years ago, because you don't know the difference you make. You never know. And I could never say thank you enough. And I'm not speaking just for me. I'm speaking for a lot of people. And based on my faith, God bless you for choosing the helping profession, because a lot of people have been impacted and will continue to be impacted. So I would close it with that. And thank you guys for being on tonight. And thank all those folks who tuned in to view this episode of GFBF Talks. And we want to continue doing these and hoping that something was said that resonated with somebody out there. And we'll continue to do these. And for those who want to support the Georgia Firefighters Burn Foundation, you can go to our website at www.gfbf.org, because we can use all the support we can as we continue providing help, hope, and healing beyond the burn. So thank you guys. I love you. And be well, be safe, and be well, and continue helping. Bye-bye.
Thank you. I love you too.